Right now on WSOC tonight, predicting the next hotspot. By now, you might have heard how China used phones to track people and the coronavirus. The technology exists, but privacy concerns are keeping it from becoming a reality here. Some doctors aren't letting that stop them, though. Our Tony Sadiku says a Duke researcher is hoping that you'll volunteer your data for the greater good.
In the fight against coronavirus, researchers say a key weapon may be in the palm of your hand, your smartphone, and the data you put into it. I spoke today with Dr. Jesselyn Dunn, assistant professor at Duke University. Dunn and her team launched a new study this week called COVID-Dentify to help people determine if they have COVID-19.
The ability to collect information about somebody's health without having them needing to be physically present is incredibly useful, particularly now.
If you want to participate, it's simple. Just go to coviddentify.org and click join. You'll get survey questions to your email once a day asking if you feel sick or if you've been around family, friends, or coworkers. There's also a wearable technology component for Fitbit and Garmin watches that'll help researchers collect more information they believe will help stop the spread.
So right now it's primarily through technology, like wearable technology. Do you anticipate some type of, demographically skewed information for people who may not have the wearable technology?
Absolutely, and that's something that we've been thinking a lot about because we know that already there have been health disparities seen in the COVID crisis, and we don't want to exacerbate that any further. And we're applying for funding to hopefully be able to purchase some devices in the future, and that might enable us to actually get devices to people who otherwise wouldn't either be able to afford to purchase them or maybe wouldn't have chosen to spend their money on that.
Duke University isn't the only group using technology to try to anticipate the next coronavirus hotspot. So many of us are probably familiar with these basic thermometers, nothing fancy. But now a tech company called Kinza is using smart thermometers to essentially crowdsource people's flu-like symptoms and fever activity in real time. The data is mapped on their website, county by county. A closer look in Mecklenburg County shows a period of above normal flu-like illness in mid-March, but a steady decline since then. Kinza says it's seen a strong correlation between their data and positive COVID-19 tests. So what are you really agreeing to in the fine print when you sign up to participate? I asked Dr. Dunn about her study specifically.
We do ask people about some demographic information, and then we do ask people to donate their smartwatch data. So that I would say the jury is out on how much somebody could be traced back using that data. But what we're doing is we're not allowing anybody who's not on the research team with strict training on how to handle this kind of data to have access to it. So we're doing everything that we know to do to try to protect people's data and protect their privacy in this study.
Really interesting. Now you can participate in that study by going to coviddentify.org. I checked it out tonight and you can see there's a lot to read on this consent form. Now that's because of that question that Tony asked. Privacy is at the heart of the issue here, balanced with our safety. Now we also wanted to know if the government is trying to use this kind of technology. So we reached out to the CDC and here's what we got back. The CDC is collaborating with academic and research groups to look at a variety of analytic approaches to inform the public health response activities. And we'll stay on top of this one for you.